So, so this is oxazolidines. One more important class of drugs. These are reserved drugs. So these drugs consist of this heterocyclic ring, oxazolidines. So whenever there is oxygen and nitrogen, you should give preference to the oxygen number 1, 2, and 3. So that's why these are 1,3 oxazolidones. One means ketone. We know no, these are the ketone group. And oxazo and oxygen, nitrogen, and completely saturated. Completely saturated. That's why oxazolidine owns. Oxazolidine owns. Now, these drugs, similar to the same, they also act by inhibiting protein synthesis. They inhibit protein synthesis. Just like our drugs, whatever we have seen, except after penicillins and cephalosporins, whatever we studied, they act on the protein synthesis, either by 30S or by 50S ribosome units. 30S or 50S ribosome units. Now, as more bacteria become resistant to antibiotics, oxazolidines remains effective against many antibiotic resistant bacteria. So they are considered as last resort antibiotics. They are considered as last resort antibiotics. So these are, we preserve them to prevent resistance. When you see resistance to aminoglycosides, is that mostly because of breaking. They also have hydroxyl group. We can see it. They have hydroxyl groups. Most of them are having hydroxyl group. So what they can do is that they can bacteria which are produce acetylation. When it prevents acetylation, that is one of the important factors how this gentamicin, kanamycin is getting resistance is that they transfer acetylation. I forgot to tell, please kindly note here. They acetylate even hydroxyl group, even amino group. During aspirin synthesis, in the lab, we told O-acetylation and N-acetylation. If acetylation occur at oxygen, then it is called as O-acetylation. If it occurs at nitrogen, it is called as N-acetylation. In the same way, here also it gets acetylated. When acetylated, it doesn't show activity. It doesn't show activity. That is one of the important resistance. Another one is by breakage, by cleaving the glycosidic linkage. This is how these gentamicins, aminoglycosides, or aminocyclitol antibiotics becomes inactive or resistant. Now, coming to this, oxazolidones, these are last resort antibiotics. The most prominent ones, two drugs are present. So that is linezolide, and what is that? Tidizolide. These two drugs are approved. Remaining drugs are in a investigational. That is radacinolide, sultizolide, fasizolide, epraziloid, furazolidone. These are the furazolidone is another drug which is used for what is that? Worms. Worms. It is used for anthelmintic drug like. These are various drugs. These three drugs. This is also long back. It is in the market. This is maybe some 10 years like that. This is long back, 1950s, 60s. like that. This drug furazolidine, so furazolidone is available in the market. You can see they're effective in MRSA, methicillin resistant staphylococcus aureus, and vancomycin resistant in what is it? Vancomycin resistant. Right, vancomycin resistant enterococci. Enterococci. In this condition, we can use this drug. Now, in all these molecules, this oxazolidone is present. So this is the molecule. So here you can see it on the nitrogen. That is, we know numbering. In the previous slide, we studied 1, number 2, number 3, number 4, number 5. Now you can place a phenyl group. Anyhow, next slide we will see in SAR a phenyl groups here. Phenyl group and 5-number group. An amide group is present on the 5th carbon. You can see it. On the 5th carbon, there is amide group, which can be varied. We can see it. Now you see linezolide consists of morpholine group in its structure. Morpholine group. This is very good for absorption. Whenever the drug is water insoluble, you can attach morpholine ring to it.
That's
So
good
you can
specific
see in the drug is having non-polar portions more. So with applying morpholine, pharmacokinetic parameters, please, pharmacokinetic parameters can be attached. Now in TDZolide, what happens is that there is tetrazole structure. The basic nucleus is this. Instead of amide group, there is what is that methanol group here. CH3OH group is present here. These two are FDA approved. Then radizolide, sutizolide, poisizolide, all these are in investigational. Still, you can maybe in next another 2 to couple of years, it may come into the market once FDA or regulatories, if they get approvals. Coming to in SAR, you can see it. We've almost finished. Try to concentrate as we studied. This is the core nucleus, oxazolidine, and this is number 3. Even previous slide also we studied number 3, and number 3 is attached with phenyl groups. And we have morpholine group, which we told. This is a linezolide. Now we can give numbering to the rings. The prominent is A ring. That's why these drugs A ring is oxazolidones, and B ring is phenyl group, and C ring is morpholine. Now on the C carbons, on the C5 carbon, all this what are morpholine and phenyl group is attached at N3 nitrogen. At C5 there is amide group attached. Now let us see. A ring interacts with peptidyl transferase. We know that these drugs inhibit protein synthesis. So it acts by binding the A ring. This is very prominent. Now here what happens is that this ring can bind to peptidyl transferase of 50s ribosome units. 50s ribosome unit. The side chain here this an amide group and the methyl group is here. If still some drugs they are trying to elongate, that's what side chain hydrocarbon bond. If it is a simple straight chain, with what happens is that these hydrocarbons will interact with phosphate group on the peptidyl transferase. So that will help in binding that. And B ring is aromatic, so it can bind to this peptidyl transferase by hydrophobic interactions. And C ring you can vary. You can vary. Here we have taken morpholin. You can take morpholin. So these are the some of the SAR, and you can see it on the B ring. If you if you add a fluorine, it also very good binding is observed. Is observed. Is observed. Difluoro compounds have been found to be more promising. Now, at the C5, as we discussed, this is chiral carbon, S configuration of sp. Chiral carbon means sp3 hybridization is present. Is very important and very important. This is the SAR of oxazolidones. So as we studied, you can see now in the previous slides. So what is the see now on the benzene ring, you see here it is a morpholin group is present. What we studied here, see here we told here fourth position, the C ring modulates pharmacokinetics. Now what they done, you can see it. One drug is morpholin. Here you can see it. Morpholin entire group they placed in TD you can see it. Pyridine as well as this tetrazole structure is present here. Here also benzene one more group is present, benzene here, and they're trying with the tetrazole structure. Morpholin, instead of morpholin, they're trying with the sulfur group attached here. So all these are pharmacokinetic parameters. Pharmacokinetic parameters which they are observing. You can read these both 20 and 21 slides side by side and you can learn it. So this is oxazolidinones. Now we are almost finishing. Please sign for attendance. Now one more, you can see it. These drugs bind protein synthesis. You can see it. See, oxazolidines are protein synthesis inhibitors. They target early step involved in binding of N-formyl methionine tRNA. We most of the times we tell tRNA. Actually, it is N-formyl methionine. So here mRNA and ribosome, both will combine. So it you can see 30S plus mRNA combination. Now what happens when this is combined? The third one comes, that is formyl methyl methionine transferase tRNA. Now here our drugs linezolide blocks the formation of initiation complex. Mixing of tRNA with 30S with ribosome and mRNA will be inhibited. Will be inhibited. This binding, even 50S ribosome and all this will be stopped. So when it is stopped, there is no amino acid elongation. No amino acid elongation it occurs. So that's what we told. Inhibit early step process. Whereas other drugs, you see, aminoglycosides, macrolide, these drugs will block uh, what we told. For example, aminoglycoside, we told mm, uh, misreading of codon. That means tRNA is already bound to mRNA and ribosome complex. So that's what we are telling in this diagram. You see, they block these drugs, will block here. Even tetracyclines also will block it. Whereas this oxazolidine diones will block the early step of this. Maybe this is the reason why these drugs uh, are acting on resistant and acting as a last resource drugs uh, during infections and during infections. Now, almost finished. The main side effects you see, um, uh, bone marrow depression is there, or suppression, radiculopathy, one of the dangerous, optic neuritis. Radiculopathy means optic neuritis, and serotonin syndrome. You fluctuates your serotonin levels, and rashes will be present. So these are important side effects and uses we have seen. Whenever you have problems with this methicillin resistant staphylococcus and vancomycin resistant endocarditis, you can use these drugs in those conditions. So this is my lecture notes. Any doubt, please? Thank you. If you don't have any doubt, we can leave.